Up first, I'm going to introduce Jamie Fanous. Jamie is the Policy Director at the Community Alliance with Family Farmers, or CAF. She focuses on working with farmers to create and advance policies that are rooted in social justice and equity. In her full-time position at CAF, which is a California-based nonprofit, she's actively working on transformational policy change. She works to create avenues to bring farmers into the policy-making process to collectively tackle some of the biggest barriers our small-scale and BIPOC farmers face, such as land access, drought, infrastructure, and more. She believes the only way we can create true system-level change is to ensure those most impacted by policy decisions are in the policy-making seat. Prior to advocacy, Jamie has worked in a range of positions from technical assistance and on-farm research in climate change and soil health to managing an urban farm actively engaged in the local community. She has had the opportunity to work on farms in various parts of the world, from Ghana to Panama, which has shaped her views and perspectives on cultural foods, sustainability, and community. She holds an MS in Agricultural, Food, and Environment and an MA in Environmental Policy and Planning from Tufts University. So, Jamie, I am going to let you share your slides, and I'm going to stop sharing.
Hi, everyone. Good morning. As I'm getting my tech together here, I love to hear there's another Tufts person out there. What a treat. We're everywhere. So hopefully this works. Okay, can folks see that okay? I'll turn it into slide mode. Okay, can you see it?
Yep, we can see your screen.
Perfect. Shannon, please cut in if I'm going over time. Do not, I will happily be interrupted. And thank you for that nice introduction. It's good to be with you all this morning. So yeah, I'm just gonna go through a little bit about CAF, talk about how we come up with these policy priorities, and like kind of be a little wonky of like, what does that mean in Sacramento? What are we actually doing in Sacramento? Because we mostly do state level policy and a little bit of federal. But just to start, CAF stands for the Community Alliance with Family Farmers. We're a 46-year-old organization, which is pretty wild. And we advocate on behalf of about 8,000 California family farmers across the state. What is a family farmer, you ask? It's truly anyone that is committed to growing healthy food for their community. We often use terms like local food producer or small scale farmer, but ultimately scale doesn't really matter to us that much. It's really about a commitment to a set of values, which is truly just growing healthy food for your community the best that you possibly can with the most environmentally sound practices as possible. We have about 40 staff now that are up and down the state. In fact, most of the staff at CAF are technical assistance providers. They support farmers on the ground, kind of meeting farmers where they're at in a variety of different like programmatic containers, as you'll see kind of listed here. And in fact, yeah, my slides are out of date. We're growing quite quickly, and we're at, yeah, it says 35 here. We are very much at 40. But it's, yeah, so going back to programs, we have an ecological farming team that's committed to working with farmers on sustainable pest management, soil health practices, working on supporting farmers around regenerative agriculture or sustainable agriculture, choose your term these days. We have a farm to market team, which is heavily centered around the Central Valley and the Central Coast, working to primarily support underserved farmers access more stable markets, setting up a community supported agriculture program, or sell to a farmer's market, or find a food hub or establish a food hub. We kind of do it all, and really, with all of these programs, really focus on uplifting underserved farmers and farmers of color, and particularly when it comes to farm to market, supporting farmers where English might not be their primary language. So there's a massive set of barriers to accessing markets when you're dealing with language and cultural challenges. So we also have a farmer services program, which does everything from wildfire technical assistance, food safety. We have a tech hub, really focusing on uplifting technology that supports small scale farmers, since when it comes to tech, small scale is not the priority for some of these investors. And then we have a policy and advocacy team, which is my shop. We're small but mighty, and we do a lot of work in Sacramento, as well as in community, connecting really farmers and community members with their elected officials, providing policy education opportunities, and then really working on legislation and passing bills in Sacramento. So the way that we do that and how we come up with our set of, like, what are we going to talk to elected officials about? We get that from farmers directly. We're very much grassroots and embedded in what farmers are telling us in order to come up with our set of policy priorities for every given year, which is quite uncommon in Sacramento. You'll see a lot of people walking those halls just on their own mission, and not really embedded in communities. So we find this really important and really core to our values and our work. So this past fall, so every fall we do an intensive listening process. We do in-person gatherings, we do online surveys in multiple languages, we talk to farmers one-on-one. And this past fall, we engaged around 600 farmers across California through that process. About 47% of those folks identified as BIPOC, over 50% identified as female, non-binary, non-conforming, and LGBTQ. And these are the priorities that we came up with as a result of that engagement. The number one priority is, of course, capital and infrastructure. A lot of farmers are telling us they keep on hearing about funding through these programs, but never see it themselves. So state level programs, federal programs, there's always these, oh, there's plenty of money, but farmers never see it. And that's due to a number of barriers. One being, tell a farmer that spends 16 hours a day farming to then apply for a grant and learn an entirely different language, which is the California and the federal grant program. So actually finding ways to create a bridge there is really, really important to us. And oftentimes, and recently, we just hire grant writers to do the work for these farmers. But yeah, so the way that some of these slides will look in the next few slides is there's this implementation component, which means that there's already a program at an agency, let's say California Department of Food and Agriculture. And so we're just working on the implementation of these things. And then there will be something around like action. And that means like these are new things that we will be working on advocating for in the coming year. So yeah, a lot of implementation. CDFA, the California Department of Food and Ag, currently holds a farm to community food hub program. That was legislation that was passed several years ago, and they have yet to implement. And that is intentionally to create new food hubs in the state of California, to fund the infrastructure and the capital necessary to establish one. And a lot around implementation is continuing to ensure state grants and loan programs are inclusive of small and underserved farmers, Many of these grant programs use language and are extremely burdensome and are not accessible to farmers, and we're constantly advocating for reform. Some of the actions are establishing a brand new small farm equipment sharing and cooperative development program. And this is new legislation, or last year we introduced legislation and it got passed through the legislature, but was vetoed by the governor due to budgetary issues. We are trying that again this year and hoping for the best. And I'll share a link with everyone at the end of how you can sign on in support of that. And that's essentially funding for equipment sharing, equipment tool lending libraries for farmers to share really high value and high cost equipment that they typically couldn't access. So something like a seed drill, which is helps farmers apply cover crops, which is a conservation practice that could be upwards of $20,000, which is something that small farmers do not just have sitting around, that is for sure. And then another action here is around climate bonds. So ensuring that there's a lot of bonds floating around the legislature. One of them is a climate bond, and we want to make sure that in that bond includes funding for all of our core priorities. The next major priority is around access to water, which is not surprising probably to anyone. We're working a lot on implementing a program of our own actually at CAF through state funding to include small scale and underserved farmers into the Sustainable Groundwater Management Act conversations. So this act was passed many years ago, and the intention of it is to basically reduce groundwater and regulate. Groundwater has never been regulated in the state of California, and this act is intending to do that and sets a 2040 goal of all regional groundwater sustainability agencies need to have a plan and have implemented that plan on how they will sustain their groundwater. In the past few years, we've seen that small farmers are not even aware of this potential regulation and are not being included in those conversations. So we have a program that we're currently rolling out to make that more inclusive. We're also working on some programmatic efforts around dry farming, education, and outreach, which is relevant to a lot of folks in SL County around wine grapes and supporting more education around dry farming wine grapes. The next priority here is access to land, which is a big one. Fundamentally, the majority of land owned in the state of California is owned by the top 5% of landowners. So the smallest percentage of owners own nearly more than half of the agricultural land. We are increasingly seeing that land is being purchased by hedge funds, corporations, pension funds, endowments, and slowly shifting away from actually farmers and community members. So we're working on legislation to prevent that, as well as working on legislation of how do we actually put more land in the hands of those that have been historically underserved, particularly communities of color that have never had access to land or have had their land stolen. And so we've been working on we established what is called the California Agricultural Land Equity Task Force through legislation, and that is now being facilitated by the California Strategic Growth Council. That group is made up of pretty much exclusively people in community, farm worker representatives, farmer representatives, smart, educated nonprofit partners of ours, and their mission is to establish a set of priorities and policy recommendations for the governor by 2026. So we're overseeing that and its evolution. In terms of action and research, it's how do we actually solve this purchasing and consolidation issue? There's some legislation right now that is planning on banning hedge funds from owning land in California, and we're paying close attention to that. The next one is around weather. So actually we're seeing more and more, and I know that this is a big thing on the coast in particular, is extreme weather events are impacting farmers, and small scale farmers do not have safety nets. They don't have insurance. They don't have access to any funds laying around like a lot of larger corporate farms do. So if you experience a climate disaster and lose tens of thousands of dollars, you might go bankrupt. We are working on legislation and advocating for funding for what is called the California Underserved and Small Producer Program, CUSP, which is basically provides emergency relief to farmers directly or to nonprofits like CAF to allocate funds to farmers directly. This program has facilitated funds for COVID, for drought, and now winter storms. And we're constantly advocating for more money to be put in that pot, since we're seeing a lot of our farmers not receive that funding. And then the last one here is basically business viability and uplifting cooperatives as a solution to small farm stability. We increasingly hear that farmers need more assistance on bookkeeping, taxes, labor regulations to ensure that their business is remaining viable. And there's just a lot of administrative needs due to regulations in the state of California. So finding ways to alleviate some of those challenges or support that farmers dealing with them, as well as finding opportunities to uplift the formation of more cooperatives. More and more we hear from farmers that they know that they need to work together in order to survive the aggressive constraints that they are increasingly facing, from weather to consolidation to market pressures. So forming cooperatives, whether it's a land co-op or a market co-op, or creating a co-op and having shared insurance, like those are all options. And we're trying to find more ways to increase the technical assistance around farmer co-ops. So I think a lot of that's named in here, and these implementation action and research is just continuing to uplift and find avenues to establish more co-ops, farmer co-ops in the state of California, since there are very few. And there's only about 2 whole people that can provide that kind of technical assistance to farmers in the state, which is pretty insane. And then the last slide I wanted to share here is just a reaction to basically the governor proposes his budget in January for the 24-25 fiscal year. And then just between January and like May, June, the governor and the legislature negotiate on what that budget actually looks like. Considering the state is in a roughly $60 billion budget deficit, he is proposing lots of cuts. Those cuts, I'm sure many of you are familiar with, since many of you are in the food access space and have been paying attention to CNIP. I wanted to just highlight a few more here, which is proposed cutting $14.4 million to the Farm to Community Food Hub program, $12.9 million to the CUSP program that I named earlier, that's emergency relief that he is cutting. So if farmers don't receive that funding, they will likely go out of business. And so, yeah, just highlighting those pieces. Those are things that we are actively advocating to be restored, basically meaning to reject his proposal is what we're telling the legislature to do, and to keep funding in these pots, so we can actually establish food hubs and get farmers the relief that they need. So that's about it. This is my contact information, as well as the contact information of CAF's fantastic lobbyist, Michael Jared, who helps us in Sacramento navigate the chaos. And I believe I will take questions after the next presenter, if that's correct.
Great. Thank you, Jamie, for that information. And yes, we're going to hold questions until after our next presenter. I just saw a quick question in the chat, and CNIP is part of Market Match. Yes. CNIP enables us to get federal matching funds.
So it's even sillier that he has cut this, because he's basically cut state dollars and any access to federal dollars. So you can just double that number and say, that's a really poor choice, Governor Newsom, which I know many of you are doing.
Great. All right, thank you so much. Please hang on to your questions, and we're going to move on next to Matt Lee. So Matt is a PhD student in the Population Health Sciences program at the Harvard School of Public Health, Department of Nutrition. His research is focused on evaluating existing and potential nutrition policies and programs that are poised to reduce cardiometabolic disease. And he is currently supporting projects related to the advertising and sales of sugar-sweetened beverages, which we often refer to as SSBs, following an SSB excise tax to diet quality during the COVID-19 pandemic and to the cost effectiveness of national and state level nutrition policies. So Matt will be sharing his work related to exploring the health equity benefits of sugary drink excise taxes, evidence and reflections from California and beyond. So Matt, if you want to share your screen.
Yeah, you can let me know if this all looks good to you. And while I share, I'll just say that I am from California. I grew up in Sacramento, and then I spent a lot of time in the Bay Area. Can you see the presenter view, or can you see?
We see full screen.
Full screen. Okay, wonderful. And I only moved to Boston about 5 years ago, so it's still a new experience for me. But thank you for the introduction. I want to start us out by making sure we're all on the same page around the pervasiveness of sugar-sweetened beverages, or as we call them, SSBs, and how they contribute to health and health disparities in the US and globally. So SSBs include things like soda, energy drinks, fruit sports drinks, as well as any other items that have added sugar-based sweeteners. Consumption of SSBs is a major contributor to adverse health, and from both randomized trials and observational studies, we know that SSBs are associated with things like obesity, diabetes, and metabolic syndrome. While consumption of SSBs has declined overall in the US in recent years, more than 50% of all adults and 60% of all children still reported consuming any sugary beverage on a given day, according to data from NHANES. Even more concerning are disparities in SSB intake that exist along dimensions of race and ethnicity. So in the US, the prevalence of consuming SSBs is as high as 78.3% for non-Hispanic Black and 73.8% for Hispanic adolescents. And in a large comparative risk assessment, some estimate that SSBs alone are responsible for nearly 13% of all cardiometabolic deaths for non-Hispanic Black individuals in 2012. And that was the leading cause for that group for that year. This plays out not only at the national level, but also in states like California, where consumption of fruit drinks among children below the age of 12 has actually increased over the past decade, according to the California Health Interview Survey. Among adults from 2011 to 2018, average consumption of soda and fruit drinks was highest among those reporting the lowest income, and for those who identified as Black and Hispanic, who reported consuming SSBs about twice as frequently as higher income and non-Hispanic white Californians. We also know that SSB consumption is unequally distributed geographically, and consumption is highest in Californian counties with greatest socioeconomic inequality, including Lake and Tulare counties. These are counties where poverty rate is also about 18%, and per capita income hovers around $30,000 on average per year. And so as an aside, in case you're interested in looking at some of this data yourself, there's a really great data platform out of the California Health Interview Survey called Ask Chiz. And so I would just encourage you all to look at that tool, and you can pinpoint down to the county and city level to look at some of these measures of health that we as researchers are interested in surveilling. Okay, so these patterns aren't random. And when we're thinking about equity, we need to consider the structural and commercial determinants of health that we might imagine intervening on as public health advocates. And so while there might be a number of reasons why differences in SSB consumption exist, a well-documented one is the practice of targeted marketing by beverage companies. And so the video that we're about to watch, which I'll just show a piece of, was part of a TV and social media campaign created by Coca-Cola in 2015 as part of Hispanic Heritage Month. And I want us to think about the types of messaging that Coke is using here and really pay attention to how brands create a sense of brand affinity by attaching themselves to these broader cultural values. And so the link for this is down below in case you're interested in watching the full video after this call, but I will just play a little bit of it.
I don't think we can hear it, Matthew.
Oh.
Or Matt.
Can't hear. Okay. Well, I encourage you, I will paste the link into the chat and you can all watch it on your own time. That's too bad.
I think if you hit play, there might be an option to play audio through the computer. I'm not exactly sure.
Oh, well.
There we go.
Hola. ¿Cuál es tu apellido?
Garcias Rodriguez.
Ortiz.
Oh, it's backwards. Reyes.
One tattoo my family will.
Yeah.
I'm proud to be a Perez because we're invincible, we're unstoppable, and we're dreamers.
Reyes means kings. My family comes from royalty.
Behind every name, there's a history, and nothing comes easy for us. Being Latino is pride, it's hard work, it's fighting through the tough times and keeping faith. It's being optimistic, it's loving, it's caring. Orgullosa de ser Pérez, orgullosa de ser Latina, orgullosa de tener fe.
I am extremely proud to be who I am, to be me, to be Ortiz. I definitely will never give up my last name. Ortiz must go on. What if I marry a Cooper or something?
My son carries my name and I hope he has kids and I want to be a grandfather and little Santa Marias, you know, running around and stuff.
Orgullosa de ser Ortiz.
Orgulloso de ser Perez.
Orgulloso de ser Santa María.
I'm proud to be Reyes.
Orgulloso de ser Rodríguez.
All right. Quick raise of hands. Has anyone seen that commercial before? No, first time. Okay. Yeah, I have this distinct memory of watching it in 2015, and so it's really interesting. All right. So in addition to that form of marketing, beverage companies target our lawmakers directly to keep consumption high as well. And so from 2017 to 2018, the industry spent $11.8 million to influence statewide policy, including money they devoted to lobbying, charity, and direct campaign contributions. So their efforts have resulted in statewide preemption laws that prohibit the passing of local taxes until 2031, and the failure to pass additional legislation like sugar warning labels that would otherwise improve health behaviors as well. And so against these disparities, taxing the distribution of SSBs is seen as one promising public health intervention to simultaneously curb consumption and counteract other industry drivers of intake. To date, 7 cities in the US have enacted excise taxes on sugary beverages, including 4 in California. And so far, these evaluations of taxes have found them to be incredibly effective at reducing purchases and sales. I'll also note that the way those taxes work might differ based on the city. And so while most of the cities tax beverages with added sugar only, Philadelphia has actually enacted a tax on both sugar and artificially sweetened beverages. And they did that for a number of reasons relating to perceptions of who drinks diet versus regular beverages and how that differs by social class. So a common source of misunderstanding among the general public is how these excise taxes work in the first place. And so we're not talking about a tax that gets added at the register that's paid directly by the consumer, but one that distributors themselves are required to pay based on the volume of their products. And so what happens is that those distributors are taxed at a rate, and they then raise the shelf prices of products that consumers see when they're making purchasing decisions in the store. And we know from studies that when you raise the prices of sugary beverages, people purchase less of them. If people are spending less on sugary drinks, and if that happens more so among groups that have historically experienced greater health disinvestment, then we might imagine that an excise tax would lead to improvements in health equity by reducing disparities in SSB consumption. Second, taxes generate important revenue that can be reinvested in communities and integrated into things like community health improvement plans in order to improve health equity further. Because of their wide reach, SSB taxes so far in the US have generated over $133 million annually, and that's all money that can be used to advance population health. So taxes are theoretically a really great solution that come with a broad range of benefits. But unfortunately, preemption laws have hindered new studies of taxes and left us with several policy relevant questions, including how taxes might alter downstream health outcomes, how they might work at the state level, and whether they're likely to improve health equity. And so to answer those questions, we used a microsimulation model developed as part of the Childhood Obesity Intervention Cost Effectiveness Study to simulate the impact of a California tax over a 10-year period with a tax implemented in 2023 to understand the projected impacts to obesity and health equity. And this was work that was done in collaboration with partners at the California Department of Public Health and was published just last year in the American Journal of Preventive Medicine. And if you'd like to know more about the methods we use and why we think they're reasonable, I'm happy to chat more offline, or you can go to our website for the technical documentation. So over 10 years, we found that a 2-cent per ounce California SSB tax would lead to $4.55 billion saved in healthcare costs, prevent 265,000 cases of adult obesity, and result in 113,000 quality adjusted life years gained compared to if no tax were implemented. The tax would result in about $112 generated in health-related cost savings for every dollar invested in implementation, owing to modest costs to actually implement, and pronounced reductions in SSB consumption we see following a tax. Our results also show that SSB taxes are a prime example of a population-wide policy that also has the potential to reduce health disparities, at least those related to SSB consumption and weight. We found that SSB-related intake and spending would be reduced across all racial, ethnic, and income groups. And we found that those with lower incomes and those identifying as Black or Hispanic were projected to experience the greatest declines in these outcomes, as much as 30 liters per year for those in the lowest income group. Similarly, we found that obesity prevalence levels would decrease relative to no tax for all groups, and that the largest reductions would be seen among Black, Hispanic, and lower income populations. For example, reductions in obesity prevalence among non-Hispanic Black and Hispanic individuals were nearly twice the reduction among non-Hispanic white individuals. And so taxes themselves are likely to improve health equity directly, and they're a cost-saving population-level intervention that would lead to greatest benefits for low-income and Black and Hispanic individuals who would experience the largest reductions in consumption. That's related to that first pathway that I described earlier on how taxes work by increasing the shelf prices of sugary beverages. Second, taxes also represent an opportunity to engage communities and improve health equity further through the specific and targeted use of tax revenues. According to the Rudd Center tax calculator, a statewide tax policy would produce $1.6 billion annually for the state. And so far, the revenues from city-level taxes have gone to programs that some of us may be familiar with and passionate about, including those that increase access to public schooling, access to healthy foods and beverages, and childcare. And I've listed some examples here from Berkeley and Oakland, so you can see the range of programs that are funded by tax revenues. I'll close by just returning to this figure, hopefully having shown you some evidence that yes, taxes work to reduce health disparities and improve equity, both by reducing spending among groups that historically consume more sugary beverages, and through the redistribution of revenues to community programs and policies. And here's my contact information. I'm happy to answer questions offline as well as after this session.